Good morning. Today I'm going to show you some exercises that you can do first thing in the morning to try to alleviate those early morning symptoms you might be experiencing in your low back. My name is Roxanne and I'm a physical therapist with PT Health Academy. There are two reasons why you might be a little bit more sore in your low back in the morning. First, when you lay in one position for a long period of time, your joints in your low back can get kind of sticky and stagnant. And then when you go to move or get up, those first movements can be a little bit triggery as you get those joints moving again. Second, when we sleep and we're laying, our discs and our spine reabsorb the water that we lose during the day. So when we're upright and loading those discs, they lose some fluid, lose some height, and we lay down, we reabsorb that water and regain that height. And this is mostly a good thing, but it does increase pressure in the disc in the morning. And if you have any pathology in that disc, as you go to get up then and load, you're adding even more pressure, which can be a little bit triggery first thing. So I'm going to show you some exercises to do to try to alleviate these conditions to see if we can get you feeling a little bit better when you first get up out of bed. Okay, let's get started. Most people sleep in side lying. So when you wake up, the first thing you're going to do in side lying is just 10 to 15 little pelvic tilts. Pelvic tilts are when you roll your pelvis front to back. I would encourage you to keep it small, and then as you're comfortable, you can make it bigger. We're not trying to increase range of motion here. We're just trying to lubricate the joint surfaces and increase blood flow. Okay, 10 to 15 there. Now the rest of the exercises are better done laying on your back. So I'm going to ask you to flip on your back, but please don't twist to get to your back. You want to push and roll like a log, and that will help protect your back again first thing in the morning. Now in this position, you're going to again do a set of 10 to 15 pelvic tilts. Keep them small, make them bigger as you're comfortable to do that. Don't bang into symptoms, especially first thing in the morning. You'll just stir them up a little bit. After those pelvic tilts, next we're going to do hip butterflies. Put your feet together, open up your hips nice and wide. So hip mobility, increasing that hip mobility is really good for your low back. The looser your hips are, the less work and load and strain your low back has to endure. So we're going to activate and lubricate and increase mobility in those hips before we get up. Good, 10 to 15 of those. Now the next one you're going to do is put your feet shoulder width apart and do some glute sets. You're going to really squeeze your butt, clench your butt, pretend like there's a nut in there, you're trying to crack that nut. 10 to 15 reps that really activates your glutes, helps increase blood flow to the whole system. After you do that, now we're going to move on to bridges. You're going to do a glute set and then lift your butt up off the bed. Now you'll notice that because the bed is squishy, it's hard for me to lift very high, but I'm not trying to increase strength here. I'm not trying to increase range of motion. I'm just trying to increase blood flow and lubricate joint surfaces. So these don't have to be big. Once you've completed those, we've now done 4 or 5 exercises of 10 to 15 reps each. That's at least 40 reps, 50 reps of exercise before you even get out of bed in the morning. That can be really good medicine to help, again, increase blood flow, lubricate those joint surfaces. Now, one of the most important things is, how do I get out of bed from here? Again, I'm going to ask you not to drop your hips in relation to your trunk and add that twist to your low back, especially first thing in the morning. You're going to straighten one leg, push with your heel, reach with your hand, and roll like a log over onto your side. Then from here, you're going to pull both knees up, drop your feet off the side of the bed, push with your hand and your elbow to push yourself back up into sitting. Notice that I preserved what I call my trunk rectangle, 2 shoulders, 2 hips. You never want that rectangle to get smaller, you don't want it to get bigger, and you don't want it to twist. So when you go to roll and sit up, try to preserve your rectangle. Now from here, we're going to stand up. If I stand up from here, I have to bend all the way over, again, making my rectangle smaller, bend all the way over and then stand up. That's a lot of motion right before I load my spine. So I'm going to ask you to try sliding to the edge of the bed, get your feet back underneath you, and then it just requires a little tip and a push straight up. Much less motion than sitting all the way back and leaning forward requires. Give these exercises a try and see if they help alleviate your symptoms first thing in the morning as you're getting out of bed. If you can start your day off well, you are much more likely to have a symptom-free or less symptom-full day ahead of you. I hope you found this tip helpful. If you did, please like and subscribe. It really does help my small business grow. Thank you so much for listening.